Hello, future RNS. If you're watching this from Mumbai, Delhi, Kerala, or anywhere in India, and you're dreaming of that US nursing license, this video is your complete roadmap. I'm MedNerd, and today we're breaking down the NCLEX-RN specifically for Indian nursing students and BSc Nursing graduates. From CGFN verification to booking your exam in Hyderabad or Mumbai. From tackling the next generation NCLEX format to avoiding the common mistakes that trip up Indian test takers, we're covering it all. Whether you just finished your GNM, you're in your final year of BSc Nursing, or you're a staff nurse at AIIMS planning your US career, this guide will save you months of confusion and thousands of rupees in mistakes. Let's get you licensed to practice in America. First, let's understand your unique journey. As an Indian nurse, you're not just taking an exam, you're navigating an entire credentialing ecosystem. Here's the reality. While US nursing graduates just register and test, you have extra steps. But don't worry, thousands of Indian nurses pass every year, and you will too. Your step-by-step pathway. Step 1. Education verification, the CGFNS process. Before any US state board will even look at your application, you need credential evaluation through CGFNS, the Commission on Graduates of Foreign Nursing Schools. This is non-negotiable for most states. What you need: BSc Nursing or GNM diploma from an INC-recognized institution. Transcripts sent directly from your university to CGFNS. Active nursing registration with your state nursing council. Secondary school, 12th standard, certificates. Critical tip: some states like New York are more GNM friendly, while others increasingly prefer BSc Nursing. If you have GNM, research your target state carefully. Step 2. English proficiency. Most state boards require IELTS academic with minimum 6.5 overall and 7.0 in speaking, or TOEFL IBT 83+. However, if your nursing education was entirely in English, some states may waive this. Check before spending 15,000 rupees on IELTS. Step 3. Choose your state board of nursing bond. This is crucial. Each of America's 50 states has different requirements. Popular choices for Indian nurses include New York, GNM-friendly, diverse population. Texas, large Indian community, straightforward process. California, high demand, but strict requirements. Florida, warm climate, many international nurses. Research your state's specific requirements on the NCSBN website before applying. Now, let's talk about the exam itself. Since April 2023, the NCLEX became the next generation NCLEX, or NGN. This is completely different from Indian nursing exams, and that's where many Indian candidates struggle. The big difference: Indian nursing exams test memorization. You studied from Gupta and Sharma textbooks, you memorized drug dosages, you recalled nursing procedures. The NCLEX? It tests clinical judgment, how you think like a nurse in real US hospital settings. The new format: 85 to 150 questions, computer adaptive. 5 hours total including breaks. Partial credit scoring: this helps you. Even if you get part of a question right, you get points. Normal lab values provided on screen, no memorization needed. The 6 steps of clinical judgment. Every case study tests these steps. 1. Recognize cues, spot important data. 2. Analyze cues, what does it mean? 3. Prioritize hypotheses, what's the biggest problem? 4. Generate solutions, evidence-based actions. 5. Take action, implement priority intervention. 6. Evaluate outcomes. Did it work? Critical for Indian nurses, US nursing prioritizes patient advocacy, informed consent, and questioning doctors when orders seem wrong. In India, the hierarchy is different. For NCLEX, you must adopt the US nursing culture, speak up, delegate to LPNs and UAPs appropriately, and always prioritize patient safety over hierarchy. Let me break down what you'll actually face on exam day. Understanding this format is half the battle. Case studies, 22 to 33% of your exam. You'll get 3 unfolding case scenarios. Each has 6 linked questions. You'll see tabs with medical records, vital signs trends, nurses' notes, and lab results.
Force concentration
Question types you must practice. 1. Matrix types you must practice. 1. Matrix. TO. Power tie. Drag and drop to identify condition on left side. Actions in middle. Parameters to monitor on right side. 3. Drop down. Fill in blanks within sentences. 4. Trend. Select actions based on changing data. 5. Enhanced hotspot. Highlight specific words in charts. Content categories. Know these percentages. Management of care, 17 to 21%. Delegation, prioritization, legal issues, major focus area.
Pharmacological therapies, 13 to 19%. Drug calculations, side effects, interactions.
Physiological adaptation, 11 to 17%. Acute illness, hemodynamics, emergencies.
Safety and infection control, 10 to 16%. Isolation precautions, fall prevention.
Reduction of risk potential, 9 to 15%. Diagnostic tests, monitoring.
Basic care and comfort, 6 to 12%. ADLs, pain management. Health promotion, 6 to 12%. Screenings, immunizations.
Psychosocial integrity, 6 to 12%. Mental health, therapeutic communication.
Indian-specific challenge. Many Indian nurses struggle with select all that apply, SATA, questions. The good news? NGN gives partial credit. But you must practice these daily, they're 15 to 20% of your exam. Let's walk through your actual registration process, step by step, with timelines and costs in Indian rupees. Phase 1. CGFNS Credential Evaluation, 2 to 6 months. Cost. Approximately 29,000 rupees, 350 United States dollars, for CES Professional Report. Process. Create account on CGFN.org, submit documents, transcripts, license, 12 certificates. Your university must send transcripts directly to CGFNs. This is where delays happen. Pay fee and wait for evaluation. Critical warning. Many Indian universities take 4 to 8 weeks to send transcripts. Follow up relentlessly with your registrar's office. Phase 2. State Board Application, 2 to 4 months. Cost, 16,500 to 33,000 rupees, 200 to 400 United States dollars, depending on state. Submit application to your chosen state bond. Includes CGFNS report. Some states require fingerprints, can be done at U.S. Embassy or authorized centers. Phase 3. Pearson VUE registration. Cost, 200 USD, approximately 16,500 rupees, plus 150 USD, approximately 12,400 rupees, for international testing. Register at pearsonview.com/NCLEX. Use exactly the same name as your passport. Wait for authorization to test, ATT, valid for 90 days average. Phase 4. Schedule your exam. Good news. You can take NCLEX in India. Testing centers: New Delhi, Mumbai, Hyderabad, Bangalore, Chennai. Book your slot online or call Pearson View India, plus 911-204-397837. Total investment: approximately 75,000 to 100,000 rupees, 900 to 1,200 United States dollars, before you even sit for the exam. Budget accordingly. Now, the study plan. As an Indian nurse, you need to unlearn some habits and build new ones. Here's your 3-month preparation roadmap. Month 1. Foundation and U.S. healthcare system. Daily. 3 to 4 hours study. Focus. Understand U.S. nursing standards, not Indian protocols. Resources: Saunders NCLEX Review, Gold Standard, UWorld Question Bank. Key shift: stop memorizing drug dosages, start understanding nursing implications, and patient teaching. Week 1 to 2. Management of care, your number 1 priority. This is 17 to 21% of your exam, and where Indian nurses often struggle. Focus on delegation. What can you delegate to LPN versus UAP versus RN? Prioritization: ABCs, airway, breathing, circulation, always win. Legal and ethical: informed consent, HIPAA, patient rights. Leadership: chain of command, conflict resolution. Week 3 to 4. Pharmacology and calculations. Master dosage calculations, metric conversions, 4 drip rates. Focus on drug classes, not individual drugs. Know antidotes for common medications. Understand adverse effects and nursing interventions. Month 2. Clinical judgment and practice questions. Daily. 75 to 100 practice questions. Weekly. 2 to 3 case studies. Focus: NG style questions only. Old NCLEX books are outdated. Indian-specific tips. 1. Practice SATA questions daily. These are your weakness but partial credit helps. 2. Learn U.S. terminology. Vital signs not TPR, medication not drug, patient not client in U.S. 3. Understand U.S. healthcare settings. Know what happens in IQ versus med-surg versus step-down. 4. Cultural competency. U.S. questions often involve diverse populations, LGBTQ plus care, religious considerations, health literacy. Month 3. Simulation and weak areas. Full-length mock exams, 85 to 150 questions, under timed conditions. Review every rationale, even for correct answers. Focus on your weakest categories from practice tests. Rest. Don't cram the week before. Recommended resources for Indian nurses. UWorld. Best NG style questions with excellent rationales. Archer Review. Affordable, good for content review. Kaplan. Strong for test-taking strategies. YouTube. Simple Nursing, registered, Nurser for visual learners. Budget-friendly option. Many Indian nurses use Telegram study groups and shared UWorld accounts to reduce costs. Let me save you from the pitfalls I've seen Indian candidates fall into. Mistake number 1. Studying from Indian nursing textbooks. Your Inc. syllabus textbooks are great for Indian exams, but they won't prepare you for NCLEX clinical judgment. The diseases are the same, but the nursing approach is different. Mistake number 2. Ignoring the CGFNS timeline. Many nurses wait until they're ready to start CGFNS. Start now. Credential evaluation takes 2 to 6 months. You can study while waiting. Mistake number 3. Memorizing instead of analyzing. Stop trying to memorize every drug side effect. NCLEX tests if you know what to do with that information. Practice clinical reasoning, not recall. Mistake number 4. Poor time management. The exam is 5 hours, but question difficulty varies. Don't spend 10 minutes on one question. If stuck, make your best guess and move on. The computer will give you easier questions to compensate. Mistake number 5. Not practicing computer-based testing. Many Indian nurses are used to paper exams. The NCLEX interface is unique. Practice on a computer, not your phone. Mistake number 6. Cultural misunderstandings. U.S. nursing emphasizes patient autonomy. If a question asks about a Jehovah's Witness refusing blood, the answer is respecting their choice, not forcing treatment. This can be counterintuitive for Indian-trained nurses. Mistake number 7. Underestimating English proficiency. Even if you're fluent, medical English is different. Elevate, not raise. Administer, not give. Assess, not check. Small differences matter. Exam day is here. You're at a Pearson Professional Center in Mumbai, Delhi, Hyderabad, or Bangalore. Here's what to expect. What to bring. Passport, primary ID, must match registration name exactly. Authorization to test, ATT, email, or printout. Secondary ID, Aadhaar not accepted. Bring PAN card, driver's license, or credit card with signature. No phones, watches, or study materials allowed in testing room. The check-in process. Arrive 30 minutes early. Biometric screening, fingerprint, photo. Locker provided for belongings. Earplugs available on request. During the exam, computer tutorial at start, 15 minutes. Doesn't count against your 5 hours. Optional break after 2 hours, take IT. Raise hand for scratch paper or technical issues. The exam can end at a 9 time, 85 to 150 questions. This is normal. If the computer shuts off at 85 questions, don't panic. This means the computer is 95% confident of your ability level. It could mean you passed brilliantly or failed definitively. You won't know until results come. After the exam, unofficial quick results. 2 business days, $8 fee. Official results, up to 6 weeks from your state bond. No Pearson view trick works. Don't waste time checking unofficial result hacks online. You've done it. Now what? If you passed, congratulations. You're now a U.S. registered nurse. Next steps. 1. Receive your license from the state bond. 2. Apply for jobs. Many facilities hire internationally. 3. For immigration, apply for visa screen through CGFNS, required for work visa. 4. Consider NCLEX endorsement to other states if desired. If you didn't pass, this is not the end. The pass rate for international candidates is lower, 45 to 50% first attempt, but retakes are common and expected. You can retake after 45 days, varies by state. After 3 failures, most states require a remediation course. Analyze your candidate performance report. Focus on weak categories. Many successful U.S. nurses failed once. Persistence wins. The bigger picture, passing NCLEX is just the beginning. To work in the U.S., you'll need visa screen certificate from CGF for immigration. Employer sponsorship. Most common is EB3, green card for nurses. State license. Renew every 2 to 3 years with continuing education. Current opportunity. The U.S. faces a critical nursing shortage. Over 15% of U.S. RNs are foreign-born, and Indian nurses are highly valued for their strong clinical skills and English proficiency. Your timing is excellent. And that's your complete NCLEX-RN guide for Indian nurses. From CGFNS to test day in Mumbai, from BSc Nursing to USRN, you now have the roadmap. Remember, thousands of nurses from Kerala, Punjab, Gujarat, and every corner of India have walked this path before you. The process is complex, but absolutely achievable. Start your CGFNS application today. Join Indian NCLEX study groups on Telegram, and believe in your training. Your Indian nursing education is your foundation. The NCLEX is just the gateway. The U.S. healthcare system needs dedicated nurses like you. If this video helped, hit like and subscribe for more guides on U.S. nursing licensure, immigration, and career tips. Drop your questions in the comments. Where are you watching from? Delhi? Bangalore? Kerala? Let's build a community of future US RNs. Jai Hind, and see you in Scrubs in America. Med Nerd out.